The call to go digital with medical records was a business decision made many years ago by an Oklahoma company. In fact, it was an Oklahoma company that was first to put patients' information in a digital format and has told Congress how to do it. OETA's Jason Doyle has our second report on prescriptions for health reform.
It was having to manage her parents' medical records, which led businesswoman Augie Lertz to form her company, Online Medsource, back in 2003. Lertz found that every time she had to take her father for a medical procedure, she was filling out the same paperwork over and over again. She felt something had to be done to help streamline the process and eliminate possible mistakes.
The truth is, when most people go to the doctor, they get a clipboard and they're doing this because they think, I'll get back faster. But you're really doing yourself a big disservice by not giving all that information.
Lert's service allows doctors' patients to fill out the paperwork online at home, reducing the patient's time in the waiting room. And because they're usually at home, it allows them to fill out the information as completely as possible. While corporations like IBM and CDS are charging hospitals, clinics, and doctors' offices around $1 million to set up an electronic record system, Lertz has come up with a way to do it for less money, and it adheres to HIPAA rules by keeping medical records secure.
There is a base cost. And typically for a single practitioner, including forms, you're looking at around $15,000 to get them started. But that's everything. That includes the full first year, that includes their medical website, the hosting, the security, VeriSign, everything. I don't believe in nickel and diming doctors. That's just such a bad game.
Lertz says there's a yearly cost of around $2,600 to maintain their medical records site, which is easier to swallow for rural area doctors who don't have as much cash on hand to spend on an electronic medical record system.
What she has done here is she started here where she's going to make it palatable and easier and even enticing for the small physician.
Before joining Online Medsource, John Gavris spent his career at hospitals in the Dallas-Fort Worth area, seeing firsthand the need for electronic records, which could be shared throughout the complex and with other doctors treating the same patients. Gavris says the service meets two goals President Obama has set for healthcare system reform.
We're going to accomplish really what the government wants to accomplish with the electronic medical record, and that is two things: quality of care and patient safety.
Gavris says as the changes to the system evolve, it's likely the government will be paying healthcare providers based on the criteria of quality of care and patient safety. He adds electronic medical records will help doctors show the government they're meeting those criteria. From Norman, Jason Doyle, the Oklahoma News Report.